Good morning and welcome to the webinar, Community Health Choices for Service Coordinators. I'm Kayla McNally, the Project Administrator at the Pennsylvania Health Law Project, and I'd like to quickly review a few items so you know how to participate in today's event. You will have the opportunity to submit questions to today's presenter by typing them into the Q&A pane of the control panel. You may send in your questions at any time during the webinar. We will collect and answer them at the end. This webinar is being recorded and materials will be sent out after the webinar ends. If you have technical difficulties at any point, please hang up and dial back into the webinar. If the problem persists, you can email me at event, E-V-E-N-T, @phlp.org. And now I'll turn it over to today's presenter, Amy Lowenstein.
Thank you, Kayla. My name is Amy Lowenstein, and I'm a supervising attorney at the Pennsylvania Health Law Project. And this presentation today is about community health choices for service coordinators with a focus on how you can help your consumers transition to community health choices without disruption. So I first want to tell you a little bit about the Pennsylvania Health Law Project, and then we'll go through the agenda and get started on the meat of the webinar. The Pennsylvania Health Law Project is statewide. We're a nonprofit legal organization dedicated to ensuring access to public health coverage and services. We focus primarily on Medicaid and people who are Medicaid and Medicare. And we've done a significant amount of work around community health choices as well. What we do is we provide a helpline for clients and advocates. We provide free advice and legal representation to consumers. We do community education and trainings like this one, as well as self-help materials. We have a monthly policy newsletter that provides updates on public health programs, including monthly updates on community health choices. And we do advocacy to increase access to quality health care coverage and services. In the last year, a lot of that advocacy has focused on improving the Community Health Choices program and identifying issues and concerns and bringing them to the state. So in this effort, we're particularly focused on community health choices this year and next year as this rollout goes forward. So here's what we're going to cover today. We're going to review what community health choices is. It's going to be a brief review, not a full in-depth one. We're going to talk about what's changing for waiver participants, who are one of the targeted group of people who must join a community health choices plan. We'll talk about continuity of care, so how to continue getting the care someone's getting today in a waiver once community health choices starts. Choosing the right plan. And community health choices implementation issues, problems that you might see and what to do if you encounter those problems, as well as what to do if you encounter problems that we haven't even anticipated. At the end, we'll take questions. I do want to mention that this is focused on how you can help your consumers who are in waivers, and I'm using the term consumers. I know some of you might say participants. It's really about how to help them in the community health choices transition. This is not focused on service coordination entities contracting with the different plans or resolving billing disputes or issues around contacts and things like that with clients. So I do want you to keep that in mind as we go forward. And if there are questions about some of those contracting and billing issues, I'm not going to be able to answer them. So let's talk about what community health choices is. It's a new Medicaid service delivery system for adults who are in a target population that was established by the state. It is required, it's mandatory managed care for waiver and nursing home services, and eligible individuals, people who are eligible to be in community health choices, must enroll in a managed care plan. And those plans will cover physical health, nursing home services, and waiver services if the person's eligible for waiver level of care. There are 3 community health choices managed care plans. And the first one is Keystone First, CHC. In the southwestern part of the state, it's called AmeriHealth, but in the 5 counties in the Philadelphia and surrounding area, it's Keystone First. There's PA Health and Wellness, and there's UPMC Community Health Choices. These are the only 3 options. So if somebody has to be in Community Health Choices, they have to be in one of these 3 plans. The plans develop a provider network, and they provide the benefit package that's required by the Office of Long-Term Living. So OLTL, as you probably know, is the agency at the state that oversees all the waiver programs. It is also overseeing Community Health Choices. And just to touch base on a provider network, the way a provider network works in Community Health Choices and in other managed care insurance is that people have to go to the doctors and specialists and therapists that the plan has a contract with. And if they try to go outside of that, the plan's not going to cover the service. So who has to go into Community Health Choices? If somebody is age 21 or over and in one of the following groups, they have to go in. So anyone in the aging, attendant care, independence, and OBRA waiver has to go in. There's a slight exception for some OBRA waiver participants. If they're not nursing facility clinically eligible, which is an assessment that is done by the independent enrollment broker, then they're going to stay in OBRA. It's not going to be a lot of people, but OBRA is going to continue for some people. Nursing home residents also must go in, and then dual eligibles, which are people who are on both Medicare and Medicaid, they also have to join a Community Health Choices plan. Now, there are some people, and I don't know if any of you do any service coordination for the LIFE programs, but if somebody is in LIFE, which is an alternative to waiver services, where you get services usually at a site-based location and then some home care, those people can go into LIFE instead of Community Health Choices or stay in the LIFE program. So in the Southeast, which is Chester, Montgomery, Bucks, Delaware, and Philadelphia counties, there are 130,000 people who are going into Community Health Choices, and the program starts on January 1st. This slide, which you will get later, breaks down what the populations look like who are going into that waiver. So in the Southeast, there's a certain number of waiver participants who are going into, and they're the focus of this webinar. I've broken it out. So there's about 48,000. It may be higher. Some of these numbers are a little old. So there's been an increase in people who are getting waiver services. Therefore, there's going to be an increase in the number of people who go into Community Health Choices. But if you think about the waiver population, the way those of us who are working on Community Health Choices think about it is that there are 2 groups in the waiver population. There are people who get Medicaid only, so that's about 14,000 people. And then there are about 32,000 people who get both Medicare and Medicaid. Now, their waiver services are always through Medicaid, but they get other services through Medicare, which is the federal insurance program. The people who we're most concerned about, and I'll go into detail more about this, are the 14,000 people who are only on Medicaid. Those people are at sort of the most risk with Community Health Choices because everything is going to change for them. So let's talk about what those changes are going to look like or could look like. For Medicaid-only waiver participants, everything, waiver services and physical health services, is changing. So where they used to get their waiver services through a waiver, sort of directly contracted with the Office of Long-Term Living, now those services are going to go through a CHC plan, Community Health Choices Medicaid plan. But they're also going to get all of their health services, their prescription drugs, their specialists, their primary care through a CHC plan instead of regular Medicaid with the Access card or their Health Choices Medicaid plan. And what they're going to have to do is they're going to have to see providers who are in the CHC plan network, and they're going to be limited to the prescription drugs that are available through the CHC plan. The plans develop what's called a formulary, which lists the drugs that they'll cover. other population, the larger population that's going in, are dual eligible waiver participants. These, again, are people who get Medicare and Medicaid. So they have two insurances. They are also going to get all of their waiver services through a CHC plan. So that's the same for both populations. But very little is going to change for how they access their physical health services. So what happens is, when people have Medicare and Medicaid, Medicare always pays first. So if someone goes to the doctor, Medicare pays about 80% of the bill, and Medicaid pays about 20% of the bill. But if Medicare has to be the first payer. So the way Community Health Choices is going to work is they're going to get to continue to use their Medicare card or their Medicare health plan, it's called a Medicare Advantage plan, as primary. And the CHC plan will then pay the Medicaid portion. And they have to pay the Medicaid portion even if that Medicare provider is not in the plan's network. So what that means is it's going to be less critical for these people to make sure that their providers are in network. Does it help to have your Medicare provider also in your CHC plan network? Absolutely. It makes life a lot easier. It's just, it's just fewer hoops to go through. But if somebody happens to go to a Medicare provider who's willing to accept payment from a plan they're not in, a CHC plan, then that's fine too. The other thing about people who are Medicare and Medicaid is Medicare is what covers their prescription drugs. So they use their prescription drug card to get all of their drugs, and Medicare covers it entirely. There's a copay that the person is responsible for, but actually waiver participants don't have that copay. So really Medicare is doing all the work. Now, they will need to use a CHC plan for some things, like things that Medicare doesn't cover. Medicare doesn't cover dental or routine vision. So that's something that they may want to consider if they have like a favorite dentist. I don't know a lot of people who have a favorite dentist, but if they do, they might want to consider if their dentist is in the CHC plan network. Okay, so now I'm going to talk about continuity of care. So when somebody goes into Community Health Choices, they do have certain rights to continue getting the care they were getting from the same providers they were getting it from before, and that's called continuity of care. It's always time limited. So if I'm going into Community Health Choices and I see a dermatologist regularly, when I go into Community Health Choices, I can keep seeing that doctor even if they're not in network for a limited time. But eventually I'm either going to have to find a new doctor or find a Community Health Choices plan that my doctor participates in. And now I'm really focusing on the people who are on Medicaid only. So let's talk about, there's two types of continuity of care in Community Health Choices. And the first one I'm going to talk about is continuity for waiver services, which is what you guys are going to be involved in. So for 180 days, basically 6 months, all the waiver services a person was getting right before Community Health Choices started will continue. This means that the person gets to keep seeing the same providers, same personal care attendants, and use the same service coordinators and get the same level. So for example, if somebody is getting personal assistance for 49 hours a week, during that 6 months, the CHC plan cannot reduce that amount of care. And they can't force the person to go to a different home care agency or see a different service coordinator, as long as those service coordinator and agency are willing to work with that person. So, and the way it works is, even if someone switches plans in this 6-month period, they get to have continuity for 60 days. They get to still have that continuity of care period till July 1st. Or even 60 days. So let's say someone switches June 1st to a new plan, they'll get to keep it till August 1st. So people can really hang on to their waiver services for a good amount of time. But beginning July 1st, providers, service coordinators, and the waiver services people get could change. And that's when continuity of care ends. So I just want to take a moment on continuity of care for waiver services a little more. It's really about what minimally the plan has to allow a person to get. It doesn't mean that a plan can't get more services. So if you are working with a consumer whose needs change and they need more personal assistance services, they can request that. And the plan has to evaluate that and determine whether they're going to give the increase. But the plan can't come back and say, no, we're not going to increase it. In fact, we're going to reduce what you have. That's what they can't do. And there are also services that people may want to ask for that they weren't even available under their previous waivers. So one of the waiver services that's going to be available to everybody is home modifications. If you have a client who was in the attendant care waiver where they couldn't get home modifications, who's been needing a bathroom fixed to make it accessible so they can use their wheelchair to get in and out, they can request that anytime during continuity after continuity. So continuity doesn't mean you can't get more services. It just really means it's about the CHC plan not reducing them. Now, does this work? In the Southwest rollout, so Community Health Choices is already rolled out in 14 counties in the Southwest of Pennsylvania. We did not hear a lot of complaints about people not being able to keep their providers or their waiver services. But this is a different rollout. This is the Southeast. So if you do encounter problems or if your consumers encounter problems, let us know. So now I'm going to talk about a different type of continuity of care. And as service coordinators, you may have been less involved in this, but in CHC, you're going to be coordinating all of a person's care, not just their waiver services. You're going to be coordinating their Medicare services, their health services, behavioral health, any kind of health services they need. So there is a continuity care for health services like going to a specialist or prescription drugs, but it's shorter, much shorter. And it doesn't apply to all the services. It's up to 60 days for a service that's prior authorized. So let's say someone was getting physical therapy and they were prior authorized to get 10 sessions, or if it's an ongoing course of treatment. So what this means is if somebody was getting services on an ongoing basis, let's say they were getting cancer treatment at the end of December and then in January their providers aren't in network, well, the plan still needs to cover that service even if the provider is not in network for 60 days. Or if they were taking a medication that's not on the plan's formulary, the plan still needs to cover it for 60 days. But after that, the person either needs to have been moved out of that plan and found a provider that, or found a new provider or a new prescription drug. So it really applies to physical health care services, medical equipment, supplies, prescriptions, anything other than the waiver services, which have a longer and sort of better continuity of care. This is really important, this continuity of care, for people who are on Medicaid only. The people on Medicare, they're going to go to their Medicare doctors. And remember, as I said earlier, even if that doctor is not in the CHC plan, the CHC plan still needs to pay them because they're a Medicare provider. Now, does this type of continuity work? Well, if you're a Medicaid-only recipient, I would not bet on it. It's the type of thing where you want to know whether your plan has your providers in network before Community Health Choices starts. Otherwise, if they're not, there could be problems. Continuity of care doesn't apply in all situations, and it doesn't always work as it should. We do have to do advocacy to persuade plans, not just in Community Health Choices, but on the regular Health Choices side, that they're supposed to be using the continuity of care protections. So it's not as well known or understood as the waiver continuity of care. So all this boils down to the fact that choosing the right plan, especially if somebody is on Medicaid only, one of those 14,000 people who are on the waiver and on Medicaid only, is critical. It really, really matters. And I'm going to give you 3 examples where somebody could come in and have problems if they're not in the right plan when CHC starts. So this is Maria. Maria has Medicaid only. She was on the independence waiver, and she goes to her MS doctor. She has multiple sclerosis. She goes to an MS doctor at Jefferson every 3 months. Maria chose a CHC plan her neighbor chose without checking to see if her doctors are in network. When she arrives for her March 15th, 2019 appointment, that's her every 3-month appointment, she learns the practice doesn't participate with the CHC plan she chose. Now, Maria can switch to a CHC plan that her doctor does participate with, but because of the timing, that plan won't be, the new plan won't go into effect until May 1st. So she's going to have this period of time where she can't see her doctor. She's outside of the 60-day period for continuity of care, which ended at the end of February. All right, here's another person who might run into problems. This is Loretta. She has Medicaid only as well. She was on the aging waiver, and she was receiving breast cancer treatment for quite a while at Abrams Cancer Center. That's part of the Penn system. Her treatment ended in June 2018. Loretta was auto-assigned to a Community Health Choices plan. On December 27th, Loretta found a new lump in her breast, and she immediately made an appointment with her Abramson oncologist for January 3rd. But when she arrives at that appointment, she's told Abramson does not take her CHC plan. So what does she have to do? Well, she might have a problem. I mean, she's going to need to switch plans, and because it's early January, she can get into a new plan for February 1st. Or she could go to a different oncologist. It would not be at Penn because she'd have to find one that her plan had in network. Now, if PHLP got this case, if the Pennsylvania Health Law Project got this case, we would argue that she should be able to get continuity of care because it's continuation or follow-up on a treatment that didn't work. So we would make a continuity of care argument, but you don't want to have to be in that position of fighting over whether continuity of care applies. This is Ahmed. Ahmed has Medicaid only, and he was on the OBRA waiver. His PCP is concerned he's developing Parkinson's and referred him to a neurologist. The neurologist is not available until January 7th. When Ahmed arrives on January 17th, he learns that his neurologist does not participate with the CHC plan to which he was auto-assigned. Ahmed argues that continuity should apply to the neurology visit, but it takes 3 weeks for the plan to agree. So in this situation, again, if Pennsylvania Health Law Project got this case, we would recommend that he switch plans if he wants to see that neurologist, but that's not going to take effect till March because of the timing. And we would also argue that because it was a referral, he should be able to see this doctor. But that's not an argument that gets made a lot in continuity of care. It would be a new kind of argument, and we would have to really push the plan. If the plan disagreed, there would be a whole appeal process where you go internally with the plan, and then you go to a fair hearing, and that can take a long time. So you don't want to risk it. You don't want to bet that continuity of care is going to work if you can take time now to get somebody in the right plan so that they don't have to deal with these issues. So the sort of moral of the story is continuity of care is great when it works, but sometimes the plans don't understand it. Sometimes the rules just aren't clear and we have to argue about them. It doesn't apply to every situation. So don't rely on it. The reason we're really concerned about this right now, though, is because 64% of the Medicaid-only waiver participants did not choose a plan as of the last time we had data, which is early November. And as you probably know, people were auto-assigned at the end of November to a plan if they didn't choose one. So here's the good news. There is still time to help your consumers before January 1st. This was not widely advertised, although there was some advocacy, and consumers who were auto-assigned are aware now that they can change their plans by December 21st, and that plan will be effective when CHC starts on January 1st. So remember this date, December 21st. So this, if someone goes and chooses a CHC plan by December 21st, it's going to override the auto-assigned plan and any prior choice. So remember our previous example of the woman who chose the same plan her neighbor had because, you know, she thought maybe her neighbor knew what a good plan was and it didn't turn out for her. She can also change her mind. As long as whatever she chooses, the last plan she chooses by December 21st, that will be the plan that she is in on January 1st. And just so you know, and there's going to be a link in the slides you get, so you'll have a copy of this. Consumers can also change their plan at any time. Now, this is not ideal because there's a wait time, but there are cutoffs each month where a person can choose a new plan and it'll be effective the first of the next month. But there can be a wait time of like 3 weeks, 2 weeks, or even a month and 3 weeks. So, you know, while it's good to have this option, trying to get this sorted out before December 21st is really the goal. And this is something where, as a service coordinator, you can really help. We know that service coordinators are who consumers turn to when they're trying to figure out problems. We know they go to you with problems that aren't even related to their health care. But here, this one is related to their health care. And you're the trusted source for a lot of people, especially people who don't really have friends or family who can assist them, or for people who have a neighbor who's maybe not reliable with their recommendations. So the Office of Long-Term Living actually expects service coordinators to be working with waiver participants to educate them about community health choices. They're asking that people have what's called a meaningful contact to talk to people about CHC, and they're tracking this. But unfortunately, only about 25% of waiver participants have had a meaningful contact with their service coordinator about CHC. This is as of early November. So there's 75% of the people out there may not have heard anything about community health choices from their service coordinator. And I'm not saying that's you, but this is just something to know. This is a billable contact. So I know I said I was going to talk about billing, but this is something that is billable. So it is something that's important. And what we really care about, though, regardless of whether it's billable, is that you talk to your consumers and their families about community health choices. Talk to them about what it is and how it works, how this continuity of care works so they know about their rights, but also, you know, that they shouldn't rely solely on continuity of care for their medical services, and the importance of making an informed choice, therefore. You want to talk to them about like what to consider in an enrollment and how to determine if a provider is in network. And I will talk to you guys about that as well. And then you can talk to them about how to enroll, the deadline, and how to change plans if things don't work out. So let me stop and talk about some of the enrollment considerations. And this is something, I know this is a lot to do, but it's so critically important because if you have a consumer who on January 1st winds up in a plan that's really not working for them, then you're going to have to get engaged at that point to try to work out what the services are and how to get them to be able to access their providers. So it's better to sort of make sure your consumers are in the right place to begin with. So the enrollment considerations, we've kind of touched on this before, but for people on Medicaid only, they need to make sure that their medical providers are in the CHC plans network. And if they can't get all of them in, they want to make sure the critical ones that they see are in network, the ones they like and want to continue seeing. And you want to make sure their medications are on the CHC plan formulary. Continuity of care works a little better for medications, and there are actually some exceptions you can get if drugs are not on formulary. So the providers are usually more critical, but still, you got to look at the formularies. For the dual eligibles, the people on Medicare and Medicaid, if you have to prioritize who to do an outreach to, focus on the Medicaid-only recipients. Go through your list. Who has Medicaid only? I need to talk to them. you should be less concerned about your dual eligibles, but when you do talk to them, you can let them know that they should check about dental providers being in network, and that if they can get their other providers in the network of the plan they want, if they can check and see, oh, all my providers are in X plan, I'll go to that one. That will make things a little more simple for the providers and the consumer. But remember, if someone goes to a Medicare provider, even if the provider is not in the CHC plan network, the CHC plan still needs to pay that provider. And for everybody, they can then consider any extra services covered by the CHC plan, and there's going to be a link in this presentation to those services. But if somebody's a Medicaid-only recipient, considering the extra services is going to be a luxury because they really need to look at whether their medical providers are in network. Now, there are also considerations for waiver services, but this is a little more challenging because, as you know, because of the long 6-month continuity of care period for waiver services and providers and service coordinators, your service coordination entity and the home health agencies may not know whether in the end they're going to have a contract with each of the plans. So while it's worth checking with waiver providers to see which plans they think they're going to participate with, it is going to be a little harder to know for sure whether they're going to be there in the end. And that's where consumers might make changes after continuity. So when you're working with a consumer, you can give them this or even help them determine which providers are in network. And you want to make a list of their providers. So this form, again, I'm going to include a link so you don't have to have this tiny little thing. They can go through and check which providers are in which plans, and then sort of look and see, all right, on balance, which is going to be the best plan for me. Now, determining if a provider is in network, there's a few ways to do this. You can contact the independent enrollment broker or each plan directly. So there's a number here for the independent enrollment broker and their link to their online provider search. I'm going to tell you right now, the online provider search for the independent enrollment broker says that you can only search primary care practice names, but that's not actually true. I've tried it. You can search specialists too. It just doesn't describe the box properly. So you can still search if somebody's neurologist is in network. Or you can go to the individual plans and ask them. Now, the one thing that complicates this a little bit is plans are still contracting and negotiating contracts with providers. So my provider might not look like they're in all of the plans today, but it's possible that by January 1, they will have a contract with all the plans. So sometimes reaching out to the person's provider to find out who they're going to contract with or who they're trying to contract with is going to provide helpful information. And then if you do manage to get somebody who is like, oh, there's 2 plans that totally work for this person, then they can start looking at the added benefits. And there's a link, going to be a link on this as well, where you can look at the added benefits that a person might be able to get. So there's plans that offer more dental coverage, and dental is really like a commodity in Medicaid. Like dental in Medicaid doesn't do a lot. So that extra $500 that one plan has might be really important as long as that plan is going to work for the person in terms of their providers. All right, so now I'm going to talk about CHC implementation issues, and then I'm going to take questions. So this is the point where I want to talk about what kinds of things you might see starting January 1st and what you can do if they happen. Pennsylvania Health Law Project wants to be a resource, not just for your consumers, but for you, for technical assistance on issues that impact your consumers. So some of these issues may not come up, and some new issues may crop up that we're not even anticipating, but here's some of the things we've been thinking might be concerns. So one is the 60-day continuity of care period not actually being provided to somebody who is supposed to be getting it. And this is an issue that we saw in the Southwest. So what you can do is contact PHLP immediately, or have the consumer contact us, because we can work with the person and determine the best solution, which could include both advocacy and helping them switch plans. There's also situations where you might find that a provider is not in a network and the client really needs to see that provider. So if the person's outside of continuity, you can have them talk to us and we can work on determining if they should switch plans or whether there's a way to access the care. Or if it's someone you think continuity of care shouldn't apply to, we can actually work with the person and might be able to come up with some arguments that it should apply, even if it doesn't look like it should. Other things to look out for, problems at the pharmacy. So there's sort of two types of problems. One is really consumer confusion. So, let's face it, this Community Health Choices is not without confusion. And figuring out how to use your Medicaid, and if you have Medicare, figuring out how to use your Medicare and Medicaid, it's not simple. So when people go to the pharmacy, if they're only on Medicaid, they need to show their CHC card. But some of them might be showing their access card if they had fee-for-service, or some of them might be showing their Health Choices card, and some of the pharmacists might not realize that the person should be showing their CHC card. And if someone's a dual on Medicare and Medicaid, it's even more complicated, because at the pharmacy, sometimes, most of the time, their Medicare prescription drug card or their Medicare health plan card is what covers their services. But other times, their regular Medicare and their CHC card need to be used together to cover the medications and supplies. And then if they're getting over-the-counter medication that's prescribed, or like over-the-counter vitamins or aspirin, they're going to use their CHC card. So it's complicated. So in these situations, you would want to advise consumers to show all the cards to the pharmacist and get them on file. And you can explain to the pharmacist that CHC replaces the prior Medicaid coverage. So anything that used to be billed to Medicaid should go to the CHC. And you can also contact Pennsylvania Health Law Project for help or technical assistance. Another problem at the pharmacy, which we saw in the Southwest rollout, was this affected the dual eligibles, was the CHC plan not paying the Medicaid portion when someone picked up something from the pharmacy that was covered by their regular Medicare card, which is Medicare Part B. So the plans, some of the plans thought that the prescription drug coverage was all covered, but there's some things like if someone's on an oral anti-cancer, on an oral anti-rejection drug or taking certain cancer drugs, the CHC plan does have to pay part of that. And we had to do some education. We think this has been worked out, but I guess we'll find out on January 1 whether this is going to still be a problem. And then we have seen Medicare providers, not a lot, but have issues with not getting paid by the CHC plan, and we want to hear about those cases too. But we also want to hear about anything else you encounter as problems. And these are not the only problems, these are sort of the transition problems. We have seen other issues around time, how long it takes to get a home modification, not hearing back from plans, some of the plans, the quality of their notices. So these are not it. This is just some things during transition that you want to look out for. And we want to hear from you. My email's on the front. We want to know, how is it going? How are your consumers doing? Are they getting their waiver services? Are they getting their other treatments and services? Are you being keyed into when your plan approves or denies services for your consumer? Or is it a surprise to you? Because that's an important thing. You want to be able to have, as a service coordinator, open communication with the plans you're working for. And if you're not getting that, then how are you going to be able to assist your consumers? Are you encountering delays with authorizations? What other issues are there? So you can call our helpline, contact the staff email. You have my email as well. And then we have our helpline for consumers for them to understand CHC, if they're having problems enrolling, or maybe you are going to work with your clients on this, so you would call any issue with CHC. If someone's denied a service, there's no response to a request for service, they have problems getting out of a nursing home, problems with a home modification, problems seeing a doctor, you share our number. We really want to be able to help in these situations. So the slide has some resources on where you can get more information about CHC. And now I can take some time for questions. And so if you have any questions, you can type them in to the Q&A box. And I see there's only one question, which is, will the presentation be available for offline viewing? We are going to make this available. We're recording this. It takes us a little time to get it up, but we can share it with service coordination entities. This is really a presentation that we want to provide to service coordination entities, and it's not sort of for the wider public. You know, we're here. We're not the state. We're not the Office of Long-Term Living. We want to be able to help you, help your consumers get through this, and also we want to be able to have some partnerships with you and your agencies so that we can all learn about you know, what's going on with CHC and troubleshooting it together. Okay, so now I'm going to read a few, now I'm getting the questions coming in, so hold on one second. So one question was about continuity care for waiver services. The question was, does it end when a new assessment and a new person-centered service plan is completed? That's not correct. During continuity of care, at the beginning of Community Health Choices, it's 6-month continuity of care. There is a requirement to do a new assessment and a new person-centered service plan. But even if that new assessment shows that somebody maybe needs fewer hours of personal assistance services, that service cannot change until July 1st. The person still gets to keep the continuity of care, even if the assessment shows that maybe they need something less. If the assessment shows they need something more, then they should be getting an increase or additional services. But the other thing is, even after continuity ends, if a person has not had an assessment and a person-centered service plan developed, their services cannot be reduced until that happens. So there's a couple things. So no service changes for 6 months, even if the plan thinks that they need less, or you think they need less. And then after continuity of care ends, the services can't be reduced unless there has, in fact, been an assessment and a person-centered service plan. Okay, so, all right, so somebody asked the difference between 60-day and 180-day continuity of care. What's the difference? All right, let me see if I can go back. Okay, so the 180-day service continuity is for waiver services, personal assistance services, adult day health services, Meals on Wheels, the things that person has been getting and that you've been authorizing as a service coordinator through the aging waiver or the tenant care waiver right now, through the current waivers. Those are the things that people get to keep for 6 months and keep their providers and service coordinators for 6 months, the 180 days. The 60-day continuity of care period, oops, I'm in the wrong one, is for health service, for anything other than those services. That's the way to think about it. So if it's not a waiver service, then you have to look at the 60-day continuity of care period. So prescription drugs, seeing a specialist, physical therapy that you were going externally for. I don't know, there's not a big physical therapy benefit in Medicaid. Going to, let's say someone's getting dental work. You're in the middle of dental work, getting cancer treatment. That is the 60-day continuity of care period. And so basically the difference is waiver services have a longer period of time that people can keep their services going and their providers. I hope that answers the question. Oh, somebody wanted the slide with the links. First of all, we will be sending these out because the links are a little hard because you got to write down HTTPS, backslide, but I will put up the link slide again. Okay, I'll keep this one up for now. Okay, somebody asked, will CHC pay for extermination services like bed bugs? Yes, so, and we actually do have another webinar that we can send a copy of the link out to. It's on YouTube, which sort of is more of the intro to community health choices and what's covered and what services, and it contains a list. So, bed bugs, pest control is a waiver service now, going forward. So if somebody has a roach infestation or bed bugs, the community health choices plans are supposed to pay for it for somebody who's on a waiver. And so the way to access that is to, as a service coordinator, you can make a request for that service. Okay, somebody asked where somebody can find a list of providers. So one of the pages of this presentation, which as I want to remind you, I will be sending out, contains the resources for finding providers who are in network. So this is the page. It's page 29 when you get the presentation, and it has links and phone numbers that people can call. So all of the information on where to find a provider should be with the independent enrollment broker, but you can also go to the individual plans. Somebody asked if there'd be new forms after January 1st. I'm not sure what this is referring to, but all the plans may have different forms and procedures for requesting services than OLTL uses currently, and they all use different forms for their person-centered service plans as well. Okay. Okay, somebody asked, will PCA still conduct the level of care determinations during continuity care for aging waiver consumers? So Sean, I'm going to try to answer this, and if I'm not answering the right question, you can put in a different question or email me. So for people who are going to be new, so what I've basically focused on today is people who are already on a waiver and going into community health choices, what's going to happen with them and how you can help them. But obviously, people continue to be eligible for waiver services on an ongoing basis. So if somebody after January 1st wants to get waiver services, they're going to have to get them through community health choices. But what is not changing at all is the eligibility rules, requirements, or process. So they still need to contact Maximus, say they want to get waiver services, which will be through CHC, and then the Area Agency on Aging, which in Philadelphia is, which in Philadelphia and in the other counties, will go out and do an assessment of whether the person meets the minimal clinical, like medical level of care to get the waiver services. So none of that is changing. The only thing that's changing is if somebody is eligible to get the services, they're going to get it through CHC instead of Medicaid. Okay, so somebody said they have a few people who are getting chemo. What's the best way to ensure they don't lose coverage? Someone's actively getting chemo. This continuity really should apply. It's like one of the obvious examples, but what you would want to do is reach out to those people and talk to them about whether they check to see if their providers, the people doing the chemo, are in the network for the CHC plan. And as I said, this is most critical for the people who are getting Medicaid only. So if you have a lot of people, you prioritize the ones who are Medicaid only. And you can look up to see if those providers are in the network or the plan they've either been assigned to or chose. If the provider's not, then you're going to want to have a larger discussion with them about, all right, what other providers are critical to you? Let's see if we can find which plans are best, which plans have your providers in network. And then you can talk to them about, the importance of choosing a plan that has your providers in network. They can also call the the provider that's providing the chemo to find out whether they know. It's really the billing people who know which CHC plans they're participating with. So there's a question of whether CHC will pay for transportation services. So this is really about a benefit. There is a transportation benefit in community health choices. Excuse me. It does include medical transportation, so transportation to and from medical appointments in a method that can actually get the person there. And it includes non-medical transportation, and that's something that would be incorporated into someone's person-centered service plan. Okay, somebody asked, how will the managed care plan know how many units are left in the person's plan if the services were changed? So as a service coordinator, there should be processes set up to ensure that the plans are aware of the service plans, so they should be shared with the plans. As a service coordinator who's involved in the continuity, you will know what's in there, and once Community Health Choices starts, you will be able to talk to the plan about what the person has in their service plan. So that's something that a communication that you as a service coordinator can make with the plan, because once CHC starts, you as service coordinators are really, you're on the front lines with Community Health Choices the same way you were with waiver services. But now instead of talking to OLTL, you're talking to the health plans. Will PHLP be a long-term resource for waiver participants? I hope so. So Pennsylvania Health Law Project works with waiver participants, whether they're in Community Health Choices, whether they're in the area of the state that doesn't have Community Health Choices yet. We're still available. We do a lot of work around waiver eligibility, waiver services in particular. Somebody asked for an update on the transportation summit. So I didn't attend it. Other people from my office did. I wasn't available. So what happened was there was a transportation summit with SEPTA on how transportation was going to work. And there are, I believe, going to be ongoing conversations about transportation provision. And this is something to sort of watch out for. Unfortunately, I don't have a particular update. We do hope to provide an update in our next newsletter, which should be coming out soon. Either this newsletter or the next, let me see. So if you sign up on our website for the newsletter, there should be an update in the next few weeks. I'm going to go back, I'm sorry. All right. I'm reading the questions, hold on. All right, somebody asked, what if a PAS is still in the credentialing process on January 1st? Can they still be compensated for services the consumers had prior to that date while going through the credentialing process? That is not a question I'm able to answer. It's really a question for OLTL about the contracting with OLTL that then is converting to CHC. Somebody asked, will we be able to add additional services during continuity of care in case a consumer's health decreases between January 1st and July 1st? And can we access housing assistance and extermination services before July 1st? So the answer is yes. So think of continuity of care as being able to keep, it's like the floor. People get to keep at least what they were getting when CHC started for 6 months, but they can also get more. So the plans can't be like, nope, you know, this is just continuity is on, you get what you get and you don't get upset. It's if somebody's health deteriorates and they need more services, a request can be put in for those services at any point. In fact, if there are certain circumstances where an assessment has to be done and a person needs to be evaluated for their need for more services. For example, when somebody is discharged from a hospital. So yes, they can get more services, they can get new services, additional services. And remember, there are people who are going to be coming in for the first time, so they need to be able to access services too. and pest eradication, all of the services, all of the new waiver services that are available under Community Health Choices are all available starting January 1st. There's no delay in providing them. There's no official delay. I mean, it could take a while for someone to get a home modification, and we are concerned about delays there, but if somebody needs a home mod on January 1st, they can request it. If they need pest eradication, they can request it, and if they're found to need it, the plan should provide it. Okay. So somebody said, should we make plans to offer the clients information to switch the PAS, I'm assuming that's personal assistance services, on January 1st, 19? Oh, that's if not, sorry. So that was a part of the previous question. Ignore that. And then here's a note from my supervisor who's listening in, who wants to remind people that the provider networks are a work in progress. So this is something we talked about earlier. So just because somebody's provider is not in network right now doesn't mean they won't be going forward. So it's something that what I think, you can't really expect to check the enrollment broker's site every day. But a person can wait until December 21st to make a plan selection. If they know their providers are in a network, they should go right ahead and, if they found a plan that has their providers, they can go ahead and choose that plan. If they're talking to a provider who is not sure, they can wait a little bit, but you don't want to wait too late because we just don't know. It's possible that if someone's provider might not become in a plans network until December 22nd, and there may not be a way to know. And if that's a critical provider and you don't think the person's going to be able to get continuity of care for that provider, then it might be worth waiting or going into a plan that does have that provider. Someone asked if continuity of care for 60 days does include dialysis. Yes, absolutely includes dialysis. Just the one thing to watch out for is, so in the Southwest rollout experience, we found that the CHC plans were really familiar or ready for the continuity of care for waiver services, but sort of less informed about or less prepared for the continuity of care for other health services like dialysis. So if anybody has any problems accessing something that they should be getting under continuity, or maybe you're not sure if it's covered by continuity, please reach out to us. We want to, hear about these examples because they're important. It's important for us to know. We do advocacy with the state. Sometimes it's important for the state to know, but we also primarily, we want to help people get these services, and dialysis is so critical. That's something that you want to make sure somebody is going to be able to get. Okay, so let's see. I'm going to leave it open for another minute or so to see if any more questions come in, and if not, we're going to pull the materials together and send them out. So all the slides will have links in them to anything that I linked in the presentation. And going forward, I want you to just feel free to reach out to us if you want to sort of talk about things you're seeing, any concerns you have. We really do want to partner with you on this transition. You're the eyes and ears, and we want to be able to help you help your consumers make this work. I think I got
Amy, this is Kayla, and I'm seeing that there are some questions also in the chat bar that if you want, I can read out loud to you.
Can I go to the chat bar? Yeah, well, let me answer. There is one that just came in, which is home modifications a function of service coordination. So service coordinators are involved in the process for requesting home modifications for their consumers, for their participants. And how do I go to the chat box? Yeah, you might have to read them to me. I can't seem to access it.
Sounds good. Okay. Someone asked, you mentioned that the individual enrollment broker line is not clear. Do you know if there is a plan to make the line user-friendly to streamline some confusion for the consumer?
So what I had mentioned on the independent enrollment broker was the online provider search says you can search by individual PCP or primary care provider organization. And then there's this little, if you hover over it, there's like a little, I think a question mark, and it says you can also put in the names of specialists and other providers. So we have requested that that be clarified, because this is going to be ongoing. People are going to be checking that website on an ongoing basis. So basically, you can search for specialists even though it doesn't look like you can by individual specialist name.
Okay, someone asked, will each service coordinator organization get assigned a contact in each MCO for assistance in communications?
So that's an internal decision by the CHC MCOs. So it's going to depend on the plan, how they manage the communications between the service coordinators who are external and the internal plan. So I have talked to people, some have a contact, some have a more general email. It's something that's you'd have to discuss with the plan, each plan individually.
Okay, someone asked, do you know what happens for participants that were under the age of 21 on an OBRA waiver, but may be turning 21 even days after CHC begins?
Okay, well, we actually recently got a little clarification on this informally. I'm going to say that there has been a request to the Office of Long-Term Living to provide guidance on how that transition works, but our understanding is that essentially somebody who is on the OBRA waiver under age 21 is going to need to be evaluated to determine whether they are nursing facility clinically eligible or not. And that evaluation in general is supposed to happen a couple months before they turn 21. Once, if they are nursing facility clinically eligible, they're supposed to be transitioned to Community Health Choices as close to their 21st birthday as possible. My understanding is that a lot of these transitions are happening manually with the Office of Long-Term Living. And if they were getting EPSDT services, so the services that you get if you're under 21, you're entitled to more Medicaid services than adults are. There's a different standard for what's medically necessary. Those services are also supposed to continue as you transition into CHC during an evaluation. So it's a little complicated. That's sort of our general knowledge of what's supposed to happen. We have, though, requested some kind of formal document to explain this process because it is one of the more confusing transitions.
Okay, I think the last question in the chat, are Act 150 participants affected?
Not generally. So if they're not eligible for Medicaid, they're not going to be going into the waiver. There are some people who may become eligible depending on changes in income. But for now, right now, Act 150, if you're in Act 150, you're not on Medicaid, so you shouldn't be going into CHC. Same is true of options, which is sort of like Act 150 for people who are 60 and over. Somebody asked, how do we get credit for this training? This is not a training that involves credit. This is sort of a service we're providing to service coordinators, but we don't provide any kind of formal credit. And just so you know, as a reminder, this is being recorded. We will provide the link when it's ready, and we will send around copies of the slides. So is that it, Kayla?
Yeah, I think that's it.
Okay, so we've done our best to answer questions. If you had other questions, you can send emails in, and we'll do our best to answer them. And thank you for attending. I really appreciate it. We really hope we can work with you and your agencies going forward in January. Take care.
All right, thank you, everyone.